Hi everyone, you're welcome to my channel today. My name is Olain Karemu. I'm an health coach, I'm a nurse mentor and nurse coach. I reside in Ireland and I talk basically about health information as well as nursing career code and all that. So today I just have this information to share. Probably you've heard about it or it's new. So if you heard about monkeypox, you can let me know in the chat box what you know about it and what are your concerns, what are your questions. Monkeypox is a rare infection that is mainly found in the part of the West or Central Africa. Okay, I'll show you that picture again because it's really important that we know what it looks like. You understand? It's important. It looks more like sometimes like chickenpox, but it's quite different. So we know more about that today. So there have been some recent cases in the UK, but the risk of catching it is low. So I think that is kind of reassuring that the risk of it spreading is low. How can you get monkeypox? So monkeypox can be caught from infected rodents such as rats, mice, and squirrels in parts of West and Central Africa. You can catch monkeypox from an infected animal if you are bitten or you touch its blood, body fluids, spots, blisters, or scab. It may also be possible to catch monkeypox by eating meat from an infected animal or from those animals that are from Central or West Africa that has not been cooked thoroughly, or by touching other products from infected animals such as their skin or their fur. How is monkeypox spread? So it can also be spread from person to person through touching of the clothes, beddings, or towels used by someone with the monkeypox rash. Touching monkeypox skin, blisters, or scabs, or including during sex, or it can be spread through the coughs or sneeze of a person with monkeypox rash. So I talk quickly about monkeypox and the incidents majorly in the UK. And since this infection, like we said, comes from the West or Central Africa, so it's important that we all know this. We have this inflow of people all around the world, so it's important that we pay attention. Okay, so just to let you know again there that this infection is not that's, let me say, the spread rate of it is not as serious as we think. So some of the symptoms that you can find in somebody that has monkeypox, like I said, there will be rash. So you have a rash with blisters, and either you've been in close contact, including sexual contact with someone who has or might have monkeypox, even if they are not being tested yet in the past 3 weeks. So it's important that if you have this rash, you visit a sexual health clinic or you visit a health center, trying to maintain as much as possible precautions. So if you have high fever temperature, headache, muscle aches, bad ache, swollen gland, shivering, chills, and exhaustion. So these are the first symptoms of monkeypox. All right, I'll say over that again. A high temperature, a headache, muscle aches, backache, swollen glands, shivering or chills, and exhaustion. So the rash usually appears about 1 to 5 days after the first symptom. The rash can begin on your face, then spread to other parts of your body. This includes the genitals. So this rash is sometimes confused with chickenpox, like I said earlier. It starts as raised spots, which turns into small blisters filled with fluids. So these blisters eventually form scabs, which later fall off. So the symptoms usually clear up in a few weeks. So you might want to check around. Have you seen anyone with these kind of symptoms? Even if you think it's chickenpox, of course, chickenpox needs to be reported. You need to inform the person to see the doctor, to go to the clinic so that they can be properly treated to prevent further spread. Okay, so the interesting thing again about this is that it can be treated, so that's a beautiful thing to know, that the chickenpox can be treated. let's talk about how we can get it treated, how we can get the chickenpox treated. I think you might be interested to know that. So I'm going to show you here again. So when I was talking about the, the raised caps, it will appear like this. So please, let's pay attention. So the treatment for monkeypox is usually mild. Monkeypox is usually mild and most people recover within a few weeks without treatment. But as the infection can spread through close contact, it's important that you isolate if you are diagnosed with it or if you have any of the symptoms that I've earlier mentioned. You may be asked to isolate at home if your symptoms are mild. But if your symptoms are severe or you're at higher risk of getting seriously ill, for instance, if you have a weakened immune system, you may need to stay in a specialist hospital until you recover. You may be offered a vaccination to reduce the risk of getting seriously ill. And so these are just some of the ways that usually it goes away without being treated. But of course, the symptoms will be managed. So it's more like symptomatic management, just like every virus that will run its course. So a few things that you should not do and things that you should avoid if you have chickenpox. I'm just going to monkeypox. I'm going to share that with you. So although monkeypox is rare, there are things that you can do to reduce your risk of getting it while traveling in West and Central Africa or you're going to other countries. First of all, is to wash your hands with soap and water regularly or use an alcohol-based hand sanitizer. Only eat meat that has been cooked thoroughly. Okay, make sure you eat meat that has been cooked thoroughly. Now do not go near wild or stray animals, including dead animals. I know for animal lovers that could be somehow, but just for your own safety. Do not go near any animals that appear unwell. Do not eat or touch meat from wild animals. Oh my God, all the bush meats. So you need to be very careful. You need to be thoroughly cooked. Do not share beddings or towels with people who are unwell or may have monkeypox, and do not have close contact with people who are unwell and may have monkeypox. So these are just the few things I want to share with you today about monkeypox. It's out there. You need to be safe, keep safe, maintain hand hygiene, which is very, very important, as even with COVID still a little bit around everywhere. So hand hygiene is very important. You don't want to get monkeypox, and you need to be on the lookout for others. So thank you so much for listening today. If you have any question whatsoever about monkeypox, feel free to ask. Bye for now.